Today's lecture, we will be discussing another ethical case, ethics case number 3, dealing with substance abuse. So let's read. While at work, you smell alcohol on one of your co-workers. He is not acting erratically or irrationally. This is a well-respected surgeon who has been in practice for over 20 years. You are not aware of any substance abuse issues or any other issues with this colleague. What should you do? Should you A, confront the colleague and tell him your suspicions, warn him that if it happens again, you'll report him? B, ignore what you suspect, there is no proof to your claims. C, talk to the head of the department the next available time. Or D, immediately contact the hospital administrator and get your colleague to treatment immediately. And I'll give you a minute to think that over. The answer in this case is D. Immediately contact the hospital administrator and get your coworker to treatment. What do I mean by get your coworker to treatment? I mean literally, physically put them inside of a vehicle and drive them to the nearest treatment facility. If there isn't a treatment facility near you, then buy them a plane ticket, you sit down with them, and you get them to treatment. This person needs help, get them help. To do so otherwise is to put patient life at risk. You cannot justify that by delaying action. In reality, physicians with substance abuse problems take, on average, 6 years to be discovered because of coworkers' attempts to be fair, such as the other options that were available in this question. You are not doing the physician a favor if he is impaired. Now, fun fact, the most common reason a physician is reprimanded by state boards is substance abuse. Now, you might be thinking to yourself, if a physician that is caught with substance abuse, would they lose their medical license? The answer is no. If a physician is discovered to have a substance abuse problem and continues their treatment regimen until they are essentially cured, then they are allowed to continue practicing as long as they maintain their program. However, here's another question. If a physician was to sleep with one of his patients, would he lose his license then? Absolutely they would. This is considered a character flaw, and the physician would end up losing their license on the spot. And this has been ethical case number 3.